Welcome to the video today. We are so excited to be bringing another video all about a healthier you so that everyone can learn a little bit about what they can do to make their lives better every single day. And this one is focused specifically on our health. And we have Dr. Melody Rodarte with us today. She is an amazing local doctor here in the East Valley. And I'm so excited that you're here to talk to us today, Melody.
Thank you for having me. I love to educate and empower patients to take control of their health. So thank you.
Yeah, absolutely. So as we dive in, let's talk a little bit about you became a doctor. Why?
I love helping people. I know that sounds corny, but since the age of 5, I wanted to be a physician. I liked watching how people got better, and I wanted to be a part of that. And so my journey from childhood was, how do I become a doctor?
That's cool. Yeah, I'm an insurance broker, and no one ever grows up saying, I want to be a broker when I grow up. It just doesn't happen. Doctors, it happens.
Yeah, I think we have to have a little bit to make it through all the schooling. So, yep, that was me.
I love it. Fantastic. And talk specifically for me about the type of practice that you have.
Yeah, I'm a double boarded physician. I'm board certified in internal medicine. That was my first certification. I'm a DO, so I'm a doctor of osteopathic medicine. To me, that was important. I wanted to learn how to incorporate Eastern and Western medicine, take care of the whole body, and I liked their philosophy. So I got my DO degree, and then I did a residency in internal medicine, and then I went on and did a couple other things. So I got my other board in obesity medicine or weight loss medicine. And then I carry some certifications in wound care, medical aesthetics, and hyperbaric medicine, as well as advanced trauma.
Oh my gosh, that is so much. You don't look old enough to have that much schooling behind you. You look fantastic. Yeah, I love it. So the focus of the video today is what are little things that we can do that aren't expensive necessarily, or they're easily accessible, little changes that we can take in our lifestyle to make sure that we are taking responsibility for ourselves and how we are taking care of our bodies.
I love that. So that is definitely my goal, is hopefully someone can take a little piece of advice here and know that they can change the outlook of their health. I think a lot of people don't understand that for 95% of your genes, you can help their expression. Only about 3 to 5% of your genes can you not fully control. So that means that in the palms of your hands, you can decide how your health is going to go. That's huge.
That's amazing, because how often is it, well, I'm just this way, I inherited it, right?
Right.
That is so incredible. Let's talk about the first of our topics. We've talked a little bit about how you are a doctor of a specific area, one of those areas being obesity. Something that comes in a lot with that is diabetes.
Right. That's actually a huge passion of mine, is helping my diabetic patients become more and more healthy, because you're an insurance broker. Once you get that label, so many things change. And so I like to start to treat people when I start seeing that blood sugar go up before they're a diabetic, even before they're pre-diabetic. I like to discuss that. So your listeners can ask for a fasting insulin or a fasting blood sugar and an A1C level. That's going to help them out, know where they're at. Are they predisposed for diabetes? And then if you are, there are things that you can do naturally, like berberine is very helpful to reduce your blood sugar. As a supplement, cinnamon, a lot of people like to use, they'll cook with cinnamon or take cinnamon capsules. But the most important thing is your food intake. So food can be medicine or food can be poison. I like to tell that to my patients. And so reducing carbohydrates is really important. So it's not just desserts, it's bread, rice, pastas. What are you drinking every day? Because soda can have it. Iced teas might be sweetened. So lots of different things that we can do. And then I would say something that's important is there are lots of other supplements that you can do to help reduce your blood sugar as well, like natural GLP1 activators.
Oh, that's incredible. No, what I just heard though is I can't have any of all the good stuff.
Not really. It just means you have to decide when and where you have it. And
Okay.
I like to say a treat and not a cheat. Yep. And
Okay.
I don't know if any of your listeners know, they can put a glucose monitor on and see what food is doing for them.
That is interesting. So you said a treat, not a cheat. I love hearing that. And then you mentioned something, and I always get the acronym wrong, but it's the GLP1, I think it is.
Yes, yes.
Tell me more about that. What is that?
So it's a peptide that our body naturally makes. So our L cells, which is in a cell that's in our intestinal wall, actually produces GLP-1, and that's what makes us feel full, what tells our brain we're not craving food. So it's a natural peptide that we make. As we get older, and unfortunately, because of what's going on in our food system and stress, we aren't producing it as well as and so the medications came about initially about 15 years ago to treat diabetes, but now we're recognizing that we can actually, by healing our gut or encouraging our gut to release this, we can do it naturally as well. So the most common ones are like that people understand in the last 2, 3, actually up to 5 years is semaglutide, which is Ozempic and Wegovy for the branded names, and then Mounjaro or Zepbound, which is tirzepatide for the brand names. Those came out really for diabetes at first, but we understood that they're treating obesity, they're treating sleep apnea, heart disease, chronic kidney disease. And so many people, this is expensive, they have side effects potentially. And so I love that I have the option, like I said in the intro, that we can do things naturally as well as medication too. So there are natural supplements out there that can increase your GLP-1 production.
Yeah, I love that. I've always been the person where I hate taking a medication if I can avoid it. And being able to do it naturally is a big deal to me because I don't want to have that medical history for a couple of reasons. One, from the insurance standpoint, I understand that it will impact how much I pay out of my pocket for different types of insurance, whether it's my health insurance or my life insurance, even if it's through my employer, that kind of stuff.
Yes.
But then I'm also paying if I have to take those prescriptions for those. And so being able to treat it with natural supplements or how I eat is important to me.
Yes. Oh, and exercise. Exercise is so important too. Just movement. I have so many people who are like, I hate running. I hate going to the gym. I'm like, you don't have to do that either. You can just walk. You can do squats in your office. There's Pilates, yoga. Just move. That actually helps bring your blood sugar down as well. Lots of options to do before you get to the medication. I agree, because once you get that diagnosis, even if you become diet controlled, you'll always have that diagnosis.
Right.
And then you're getting yearly foot exams and yearly eye exams and having to pee in a cup once a year to see what your kidneys look like. Are they still in protein? Like it's such a huge domino effect. So why not take the steps before you get there to prevent it?
Yeah, I love it. And from the insurance standpoint, from those of you listening, it does impact our rates every single year by how we're able to make sure we're staying healthy and not actually having to go to the doctor all the time for things. So, little side note there for everyone. So, one of the things you mentioned with our natural production of the GLP-1s, I'm getting there, I'm getting better. You mentioned that it impacts how we sleep and potentially sleep apnea. So, talk to me more about that. How is what we're eating impacting how we're sleeping?
Yeah, our blood sugars can cause changes in our cortisol levels and other hormones. And so, P1, we've known that we have receptors on all of our cells in our bodies. And so, it really helps with sensitizing your body to blood sugar. So, it's using it as energy instead of sending it to the liver to then store it as fat. It also tells your liver, hey, you don't need to release sugar either, because I'm going to help the blood sugar that's in the body be used up. It just also, with you, when your blood sugar is what we call glucose homeostasis or in a good range, you're not going to be as grumpy. You're not going to be as anxious. You might not be as sweaty. You might notice you're not having as much brain fog. So there's lots of benefits to having a good blood sugar and promoting a natural peptide in your body that helps that control. And then it's more specifically, we have receptors on our muscles. And if you remember what I was saying, our muscles will help us use that glucose for energy. And so you're less likely to gain fat then.
Oh, wow. So it sounds like being able to make sure our bodies continue to create this for ourselves, whether it ends up having to be the natural supplements, how we're eating, combination of that, or even if we do need to actually get the medication. But it's kind of like this little magic, almost like a school monitor going down the hallway saying, hey, 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 no, you need to go over there and make sure that you are in the right classroom. So the liver knows, hey, I'm in this classroom. I need to be doing this, not that.
That's a great analogy. That's a great analogy because if that's really when we think about the gut brain axis, that it's following our vagus nerve on the way up and sending signals. And so this is what's
Oh,
going
perfect.
on. Yep, there you go. There are other peptides, like we call them neuropeptides because they're brain derived. And so we are increasing those neuropeptides being released as well. And I'll tell you, there aren't any drugs on the market per se, specifically for those neuropeptides. So the way that you can increase them or help them out is by activating GLP-1.
That is incredible.
Yeah.
Okay. So if I'm doing better job generating the GLP-1, however we end up doing that or need to do that, I'm going to have a lower risk of going into diabetes. I'm going to have better weight control because it's making me use the intake of food in the right way and not store it for later because I don't need to.
Yeah.
It's going to help me sleep better. It's going to help me think better because I'm getting better sleep and I'm using things like what I'm bringing into my body in a better way. What are some of the other benefits of it?
Yeah, you're going to be not craving food. You'll probably be able to not snack as much because we're snacking because we're bored, we're tired, we're angry, we're happy, sad. If you can control that overall, you're not going to go hunt for food or snack. And you might feel full. You might not finish your plate. That's really big. And so you're going to start losing weight. So not only is it helping your metabolism overall, it's also helping you with your intake. And
Okay.
as you eat less and as your metabolism is working better, you're going to start losing weight. And so you're going to start feeling better overall. You might feel like you're more productive. And that's really huge. You might notice your mood's better. Well, that's because your blood sugar's not all over the place.
So you don't have to carry a Snickers with you anymore because you're not going to get hangry.
Yep,
Okay.
that's the really beautiful part. Yeah. And this goes along with what you were talking about, like having a healthy lifestyle. So you can't just take either the supplement or the drug and think everything is going to be hunky dory. You still got to do some of the work, but it definitely helps you do the work because you're not having the food noise. A lot of my patients tell me food noise disappears. And when food noise disappears, then you're able to be in control of what your intake is during the day.
Okay. So talk to me a little more about that. What do you mean by food noise?
So some people from sun up to sundown, they are chronically thinking about food. When's my next meal? What is my next meal? And they might even be worried about their meal for tomorrow or through the week. So they can't turn off the when am I going to eat? How much am I going to eat? All of that kind of stuff. And so that's considered food noise. Even when they're eating, they might go, oh my gosh, am I going to feel full? Am I not going to be full? How long is this going to last me? And so when you shut that out, a lot of people be like, oh, I totally forgot that it was time to eat. Or I didn't worry. I didn't get nervous that I wasn't sure when dinner time was or things like that. They're
Wow.
not at the forefront of their thought process.
It sounds like that would take a lot of stress off too.
Yes.
That's fantastic. Okay. So we're not being diabetic, we're getting better sleep, we're functioning better because we're losing weight. It sounds like the next step would be joint pain, right? As we lose weight, we're going to take some of the pressure off our joints so things aren't going to hurt as much.
Yes. Because even 5 or 10 pounds can make all the difference on your joints. I think a lot of patients, they don't even realize that. And I love when they lose, let's say 10 to 20 pounds, and I tell them to go to the grocery store and carry like 2 10-pound bags of potatoes with them or
Oh my
stick
God.
it when they're in a backpack and they're like, oh my gosh, no, it was making a difference. Because then their joints, it's like loading a joint. So weight loss, and if you're reducing those types of foods, you're eating less inflammatory foods. So you might notice that you're not as stiff and you're not getting out of bed with your feet hurting. And the stiffness part is what really starts to go down when you're not eating as many inflammatory foods.
Okay, I love that. We have a lot of clients that they're on their feet all day long, or they're having to constantly walk around and do things. So I think that's going to be hugely beneficial to them because they're going to have less of the pain, less of the stiffness. Now, does it help with other things? Is there like more energy?
I would say yes. The other thing too is as you lose weight, as you're eating better, those that have a day job that they're walking all day long, they might have swelling. When they take off their socks, they're going to notice that. So with doing this, you're not going to notice as much swelling. In turn, your blood pressure could go down as well. So for every gram of carb you eat, you actually retain 4 grams of water. A lot of people don't realize it. They just think salt raises their blood pressure and makes them swollen. It's actually
Okay.
carbohydrates that do it worse.
Oh, wow.
So if you are not snacking as much, if you're reducing your carbohydrates, if your blood sugar is better, then that downstream effect is going to be less swelling and better blood pressure as well.
Okay, so with the blood pressure, that leads like high blood pressure, we think heart issues, right? That's our next step is having this better control over ourselves. We're going to lower our heart issues because we're not having that high blood pressure. Is that what you're saying?
Yeah. And the other thing too, let's say specifically why GLP-1s have been approved is they're reducing your cholesterol and they're reducing, if you're at less weight, you're less swollen, all of this. That's why it's approved for people who have cardiovascular risk or heart disease. So you don't have to have obesity to get that prescription. You just have to have heart disease. We're starting to prescribe it for that. But what if you increased your own natural GLP-1 to help reduce the chance of heart disease? So that's where I love to talk about it with people who are trying to be preventative and not want that actual diagnosis.
Yeah.
Because in your world too, if they have the diagnosis of heart disease or high blood pressure or diabetes, that can change their premium, that can change their life insurance, all of that.
Yeah, absolutely. Something that we hear a lot of times along with high blood pressure is high cholesterol. How are those two tied together?
They're really not tied together like one gives the other, but you're the root. And a lot of times, high blood pressure and high cholesterol come about when you're overweight, when you're not eating the right foods. Blood pressure and cholesterol can be genetic, but you can also change that by how you eat, how you sleep, how you live your life. Start seeing high blood pressure, and especially with jobs that are just super high stress. The women too, but I don't know why it is. I'll see it earlier in men. And of course, you want to find ways to reduce stress. So there are different supplements that you can take to reduce either blood pressure as well as cholesterol before you get on prescription medications.
That's awesome. And high blood pressure, so that's basically a constriction of the blood vessels. Is that right?
So it's they're not relaxing and compressing right. So
Okay.
with high blood pressure, there's a shear force in there, and so it's going up. And then the bottom number of it on the blood pressure is how your heart is resting. Is it being able to rest and therefore fill to then shoot up out of your heart into your aorta to your bloodstream? And that's the top number is your systole or how it's coming out. So that number is going up. A lot of times you want to relax them. So meditation will bring your blood pressure down. Walking will bring your blood pressure down. There are so many things that you can do to bring your blood pressure down naturally too.
Yeah, I always thought that high blood pressure just meant that like your blood vessels were just constricted, so blood wasn't going where it needed to go, and that's what caused the problem.
You've got all of these fine little arteries in your kidneys, in your heart, in your brain. And when there's that sheer force from high blood pressure going through it, that's where you're creating problems. And those walls can become leaky. They get a little bit of like openings or it's that scar tissue sheer force. So then if you have high blood pressure, you're going to make a plaque. And if that ruptures, then you get a stroke or a heart attack. So they do go hand in hand here when you think about it that way. But yes, I wouldn't say it's just a clamping down automatically of it. It's just it's not relaxing or it's constricting properly. I like to say they're not as pliable. They're getting stiffer.
So if we were to break it down to like third grader level, a garden hose, a regular garden hose would be like a blood vessel that has lost its elasticity.
If you left it out in the summer, it's
Okay.
going to be cracking. It's not going to be as pliable or
Yeah.
mobile, and
Yeah.
it's stiff. And
Yeah.
so water trying to get through it is the sheer force is harder. So
Got
it's taking more pressure to push through it.
Got it. And then it springs a leak and then there's a problem.
Mm-hmm.
Okay. Got it. Cool. We've talked about a lot of things today. If there was one thing that you would encourage people to walk away from this video and say, I can do this starting today, that's super simple, what would it be?
Choose to have a healthier lifestyle and work with your physician, your healthcare providers to know what your blood work looks like so that you know if you're at risk for these things because you don't have, and then you don't have to wait for it to happen to get on a medication. Let's change your lifestyle. Let's add some supplements. Let's change your sleep habits, your stress habits, your nutrition, because you can prevent having those diagnoses. Because once you have those diagnoses, can they be managed? Yes. But we don't want them. We want to prevent them. We don't want to have them. Yeah. So I think that's what my message would be.
All right. And let's say someone wanted to reach out and ask some more questions or find out more about the supplements that are available to help naturally produce the GLP-1s. How can they get in touch?
Yeah. So I have a website. There's videos, there's links on how to order and get things for wholesale. I would love for them to have an opportunity to do things naturally for sure.
I will certainly put that in the description for the video. And if there was someone out there who wanted to work with you specifically to help with their weight loss journey or help with making sure that they're doing everything possible to not get the diagnosis, how can they contact you for that?
Yeah. So our practice is called Activated Health and Wellness because I wanted people to know they could activate their health. And we're in Gilbert, and they can go to our website and ask for a consultation with our patient coordinator to know what program's right for them. I have 3 other providers that work with me. We have a weight loss program that's 20 weeks, or some people don't need that, but activated.health is our website, and our phone number is 480-571-1000.
I thank you so much for being with us today. I so appreciate it. And thank you for taking the time. It's been a pleasure.
I appreciate just being able to hopefully help people on their health journey.